Back to the Blend. It's creating a lot of buzz in the cosmetic, beauty, and medical world. We're talking about the latest in medical technology, a product that prevents scars before they even have a chance to start. It's called Embrace Active Scar Defense. It's been featured in these national beauty magazines in the past couple months. And today we're talking with one of the most recognized and highly respected board-certified plastic surgeons in the state. That man is Dr. W. Tracy Hankins, and he is here with more about Embrace, how it works, and some amazing before and afters to show you of real patient results. Doctor, great having you.
Thanks for having me, Sean.
So let's talk about this. First of all, the practice. Tell us about what you do at your practice.
I've been a plastic surgeon for over 20 years, and we have an east and west side location. Myself and my partner, Dr. Sohn. It's called Hankins and Sohn Plastic Surgery. We do all cosmetic surgery, from injectables to major mommy makeovers.
Wow. So in front of us here we have the star of the moment, the Embrace Active Scar Defense. Explain what this is and how it works.
This is a device, really. So, it's not a cream or anything patients are putting on. This is out of Stanford, one of the high-tech capitals of the world, and has shown that it really makes a difference in the scar that forms.
Okay.
And it's doing that by offloading tension. So you can see I'm putting the device on. Very simple to apply. They line it up right with the scar in the middle where that line is, and then essentially it takes the tension off the scar. So you can see as that's lifting up, that you can imagine that's each edge of the skin on each side of the scar, and that's offloading the tension to the scar.
So I'm trying to figure this out on layman's terms. So the scar is really created because that's the connection point. It's pulling, and that's why it gets big and red.
Right.
What this does is it takes the healthy skin on each side, kind of cinches them in a little bit so it doesn't have that pulling on the actual cut mark.
So the high-tech part of it is, getting the tension just right. Because if you get too much tension, you would blister on each side.
Of course.
So they went through different prototypes to come up with this device.
Wow, that is so incredible. And there's actually an animation that can show how the body can positively respond to Embrace. We'll take a look at the animation and tell us what we're looking at here.
Right, so what you're seeing here, the arrows are showing the normal tension on a scar.
Yeah.
So especially critical is the first 8 weeks or so when the scar formation is at its weakest. The body is laying down collagen to heal it, and normally that can be fairly jumbled and not real defined. Offloading the tension, which this device does, helps your body form the collagen in a more linear fashion, cross-link fashion, and take the tension off the scar as it's forming.
Wow.
And give you a better resulting scar.
Which is phenomenal, and this can be used for a myriad of different scars for a myriad of different reasons.
Correct.
So we're talking from anything that might be cosmetic surgery, or somebody who would have perhaps an open heart surgery that could be used for that scar.
Yeah,
they're shown on the arm there.
The product's been out about 2 years.
Yeah.
But the company's studies, we're going to look at a couple before and afters.
Yeah.
Really were focused on plastic surgeons, and one of the reasons why is some of the scars that we have to deal with are among the worst. Let's take a tummy tuck, for example.
Oh my goodness.
You're really removing half the skin of the abdomen in most cases.
Yeah.
So there's a tremendous amount of tension on that scar. So what the company did is they treated one side of a tummy tuck scar and not the other.
To see what it would look like.
And that's what really proved, hey, this scar makes, this product really does make a difference, as opposed to a lot of the snake oil products that are out there.
Absolutely, and there's plenty of it. Google it for yourself. You'll see a bunch. Let's take a look. We have a couple pictures that we want to see of before and afters of patients that have used Embrace, and the results are pretty striking.
Yeah, so first, this is one of the patients from the study where they treated one side of her abdominoplasty scar and used herself as the control, which is really the strongest science you can really do. And you can see the really drastic difference between the treated side and the untreated side. This is another tummy tuck patient. Just seeing that you get a beautiful, how it offloads the tension, and you end up with a beautiful scar afterwards.
It's really, and that's something that can be hidden under the bikini line, and if it were to maybe peek just for a brief moment, you wouldn't be like, whoa, what happened
still
there?
A great quality scar.
That's phenomenal, and there was another picture actually of a child's forehead. He had an unexpected injury as well.
Yeah, this is where I think that it's really going to explode is, let's say you take your kid to the ER, and, a lot of times the way a plastic surgeon might close a wound is maybe not the way an ER doc or a PA in the
ER doc just needs to get it done.
So you can see on that picture that it had been closed a little crudely. The sutures are pretty big, but parents went, got the product online, applied it, and you see the scar is almost imperceptible. So I think any scar really is a time to be thinking of using Embrace.
I think there are some people, especially in cosmetic surgery, they might have been a little bit more worrisome about doing it because of the scarring that might be left over, but this is kind of a deal maker now.
Exactly. You know, I think as a plastic surgeon, we're proud of our scars. We think we're the best. This has really opened my eyes to the way patients really feel about scars. They want that scar to be the best quality it can possibly be, and this gives them that opportunity.
And we're looking at some other products that are here on the table as well. These are for different areas of the body?
And different sizes.
Okay.
Yeah, so you know, maybe the large size we would use on a body scar like a tummy tuck or a brachioplasty.
Gotcha.
The medium size we use a lot for breast augmentation or, you know, basically a 2 to 3 inch scar.
Okay.
And then the small device, that's actually the largest selling device online, is the one that you might pick up just for a laceration. Say you go to your dermatologist, get something taken off. Because a lot of doctors don't know about this yet.
Yeah.
You know, it's getting buzz and they're hearing about it, but a tremendous number of physicians don't even know. But patients just need to go ask the doctor, but also can go online and get it for themselves and treat their own scar afterwards.
Where do we learn more about Embrace and get them? Yeah, EmbraceScarTherapy.com. We have that on the site right now. And it's really incredible stuff. I got a pretty bad cut on my cheek years ago, and they were like, it could scar, it might not scar. If I had known about this, obviously it wasn't around, but years ago, I would have known, yeah, chances are it will probably heal very well. Yeah. So it's really incredible technology. It's great having you. Thank you so much, Doctor. Again, you want an amazing medical advancement? You got to check this out. Embrace. See more amazing before and after pictures. Go to the website you see right there on your screen. That's EmbraceScarTherapy.com. In the meantime, if you'd like to get a hold of Dr. Hankins, you can visit his website or call the number listed.